Are there alternatives to prescriptive medications? We're going to talk about the top 10 most commonly prescribed prescriptive medications and what you can do naturally to regain your health. Probably the most frequently asked question I get asked in clinical practice, is there alternatives to prescriptive medications or alternatives to prescriptions? And when you get done with this video, we're going to talk about the 10 most commonly prescribed medications and some natural considerations for those. But when I get asked the question, is there an alternative? The answer is a big fat maybe. Maybe there is, but let's talk about that, because the reason why your doctor gave you a prescription was because something was going wrong. Something went wrong in the body. And some doctors like to prescribe medications. Other doctors like to prescribe supplements and nutrition. Other guys do mind-body healing. There's a whole host of options available for you. And since I'm really good about the nutritional perspective, let me give you some considerations for those. Now, the most common denominator, most common factor in this is if you'll move. Exercise is a key important to life, and it doesn't have to be an exercise that you really don't like. And let me give you an example for that. I don't like running. I've never liked it. If you told me to go run a marathon, it would have to be some extraordinary reward for me to go do that. Nothing against runners, it's just not my thing. But if you put a basketball on a court, or if you tell me to go ride a motorcycle, which is a lot of exercise, you tell me to go do, chase a little white ball around grass and do some golfing, I will totally do that because I like the activity. And one of the problems that we have with prescription drug needs is because people aren't moving enough. So first recommendation is, are you committed to move? Now the second thing is, what are you putting in your system? It's kind of like a computer, garbage in, garbage out. If you're not treating your body very well, you probably need a prescription. If you are committed to putting good stuff in your system, there's a good possibility that we can get your body to the point where you just don't need prescriptions. Now, when we talk about prescriptive medication, it's really important to remember that only you or your medical doctor can decide whether a drug is going in your system. These are just parameters. This is not meant to substitute for a doctor-patient relationship. But let's talk about some of the most common drugs prescribed and some natural alternatives. Doctors wrote over 130 million prescriptions on pain. Now that's things like Vicodin and Tramadol and oxycodone and even really strong stuff like OxyContin and stuff like that. Now, natural considerations for pain, and before I say that, I need to go back and talk about over-the-counter medications. Because people will come into the office and say, hey, I'm taking 4 Aleve, or I'm taking 4 Advil, or I'm taking 8 Tylenol, or I'm taking 2 Tylenol, or I'm taking aspirin. And those medicines, even though they're over the counter, they are not benign. They have some serious side effects. They can harden your liver, they can put you in liver failure, they can harden the kidneys, they can mess up with your GI system. And so the best way to combat pain, and this may not apply, and actually this doesn't apply to people that have had some type of traumatic incident where they were in a car accident and their tissues have never recovered, or they're a burn victim, or they had some type of severe athletic injury. I mean, those people we may not have good alternatives for them. But for normal everyday pain stuff where people are taking over-the-counter or hydrocodone, Vicodin, Percocet, or some other things, here are some really good considerations. The first thing is you got to put your body back in balance. So biomechanics, got to make sure everything is lined up. Got to make sure that the tissues are right, so some massage therapy or some active release technique, or there's an amazing therapy called Advanced Medical Integration Technique, what they call AMIT. So if you're fortunate enough to live in an area where there's an AMIT practitioner and you have muscle pain, you need to do that. Now, some other things that we can do for pain from a nutritional perspective is I have found that high-dose essential fatty acids with a proteolytic enzyme, so things like papaya, bromelain, bromogest, and stuff like that. When you combine that with about 6,000 to 8,000 milligrams of essential fatty acids, you can literally mimic the effect of aspirin or Aleve or Tylenol without having some of those detrimental side effects. And if you get your biochemistry put together, making sure that your blood's healthy, your biomechanics, your hormones, that's the best recipe for an alternative to medications for pain. Sometimes it's not possible, but in my experience, it really decreases your pain medications. Another frequently prescribed medication is statin drugs, because we think that cholesterol can increase your risk factor for a cardiovascular disease. Now, this is kind of a funny experiment, but it's literally getting this bad where if you're in a room with people and you look to your left and you look to your right, I mean, one of those three people is going to have a cardiovascular problem. And I don't necessarily think that cholesterol is the bad guy that everybody thinks it is, but certainly too high cholesterol is bad. In the American Medical Association guidelines or the Heart Association guidelines, we like people below 200. And just like blood sugar, too high a blood sugar is bad, too low is bad. And I see a lot of problems with people getting their cholesterol too low. But if your liver's working right and you're eating right, I think there's a lot of alternatives and considerations for a statin drug substitute. Now, unfortunately, I see a lot of people that have really severe effects from statin drugs where they get brain fog, they'll have muscle problems, and they just don't function very well. And so if we can help your liver be a better detoxification center, there's some good considerations. So milk thistle, a stinging nettle, red rice yeast, essential fatty acids. Again, if you get your essential fatty acids high enough, it really, really helps to clean out the liver. And I really think that there's some significant improvement that can be made with exercise, with diet, and the right supplements if your cholesterol levels are too high. Now, high blood pressure medications, things that are like diuretics, ACE inhibitors, calcium channel blockers, beta blockers, again, they have their place. And if your blood pressure is too high, it's kind of a silent disease and you're going to blow a valve and that's going to be bad. Again, going back to metabolism, making sure you don't have any stored energy. Again, that's the F word that we don't like to use in the office, FAT. Your stored energy is a huge factor in your blood pressure. And also things where your circulation, if you don't have good elasticity in the vascular system, the heart has to push harder. And so your nitrous oxide pathways are really important in blood pressure medicines and, blood pressure conditions. And so what alternatives are available if you have high blood pressure? The first thing is the stress reduction. So there's no magic lotion, potion, or pill to get rid of stress. But I like it if you will write things down. This also really helps for anxiety, by the way. But if you'll write things down, you'll journal, prayer, meditation, you can really decrease your stress levels, which helps with blood pressure. Now, two things that are really, really neat for blood pressure in the natural perspective is about 500 milligrams of potassium and about 200 milligrams of magnesium really, really help to improve the smooth muscle function and nerve function associated with your blood vessels. If you're on a blood pressure medication and you want to do something, it's really, really important that you involve your doctor and you don't just cease taking blood pressure medicines. From an herbal perspective, I really, really like olive leaf. Olive leaf has an amazing ability to decrease blood pressure and also helps with your immune system. So magnesium, potassium, olive leaf, and then my second favorite vitamin is vitamin D3. Vitamin D3 has a known effect for lowering blood pressure. So magnesium, potassium, olive leaf, and vitamin D3. The third medication we're going to talk about is thyroid medications. So things like Synthroid and levothyroxine. So when your thyroid doesn't work, man, your metabolism is a mess. And usually what happens with people that have a low thyroid is they have an insensitivity to temperatures. They're cold all the time. They have brittle nails. Their hair's falling out. They have dry skin. And usually we'll do a couple tests, a T3, a T4, and a TSH. Although most doctors just do the TSH, which really is just telling you if the pituitary gland is yelling at the thyroid. I think it's really important to make sure that you're doing a TSH and a T4 test, and even better, one of the best things that you can do to make sure that your thyroid is working is to do a thyroid temperature test. Now, this was developed by a famous endocrinologist named Broda Barnes, and what he discovered was that people that have a low temperature, and he has people take their temperature in the morning, their temperature should be between 97.7 and 98.3 degrees. If it's lower than that, you have a thyroid condition, and many people have what's called a subclinical thyroid, which means that the tests really aren't that bad, but they have all the clinical symptoms of a thyroid disorder. So what can you do to help with thyroid? A couple things. One, iodine is really, really important for thyroid function. Another thing is I really like to use glandular therapies for thyroid. So you can use some glandular pig or you can use some glandular cow thyroid, and it's like putting thyroid building blocks into the body. Now, if you've been on thyroid medications for a long time, it may not be possible to have a natural substitute or natural solution But if we improve, again, biochemistry, biomechanics, hormone balance, there may be some considerations for a substitute for thyroid medications. Again, it's not meant to substitute a doctor-patient relationship, but iodine and glandular thyroid seems to work really well for thyroid conditions. Thanks for watching part 1 of the top 10 alternatives to prescriptive medications. Part 2, it's on its way. Check it out.